I just want to kick off by acknowledging country, paying respects to our elders and to our Creator, Bayami, to Gunitakum, Mother Earth, and all our brothers and sisters that walk with us on this journey in this beautiful country we call Australia, but also all the hundreds of countries that have been here for hundreds of thousands of years. Thank you three for joining us. It's a really huge honour to have you with us and to have your expertise. I kind of figured initially we'll just ask you guys some questions and then we'll just let the conversation flow from there. And I might give a quick bio of you all just to do some introductions. So I'll introduce Tom first. Tom is a Kamilaroi or Gomeroi Man born in Gunnedah, northwest New South Wales, and a member of the Red Chief local Aboriginal Land Council. In April 2020, Tom was appointed Chief Executive Officer of Wiradjuri Proud Spirit Australia, the culmination of more than 25 years' work in Indigenous mental health and health policy, social and emotional wellbeing, clinical mental health care, suicide prevention, education, and mental health leadership. Tom has a really long list of qualifications and skills, and some of them are Chair of the National Aboriginal and Torres Strait Islander Leadership in Mental Health, Co-Chair of National Mental Health Workforce Strategy Task Force, Co-Chair of Wiradjuri International Indigenous Mental Health Leadership Group, and Deputy Commissioner of Mental Health Commission of New South Wales. So thank you for joining us, Tom, and welcome. Steve Stanton is a Gomeroi Man as well from northwest New South Wales and is currently Head of Strategy and Marketing Development at Plan Partners, part of ASX listed McMillan Shakespeare Group, specialising in providing financial and intermediary services across the human service sector. Steve worked previously as Executive General Manager at Live Better Community Services, responsible for the strategic and operational leadership of health and community services divisions, including aged care and home care, disability, primary, allied health, mental health services, child, youth and family services, early learning, building and transport services nationally. He has held senior executive roles across the health and human services industry for the last 10 years, was appointed as chairperson of the National Indigenous Engagement Council and non-executive director of Indigenous Allied Health Australia. Steve is also part of the University of Sydney's Global Executive MBA program. And last but definitely not least, Steve Hobday. So Stephen Hobday is a proud Wiradjuri Man from the Central Coast, New South Wales. He attended high school at St. Joseph College, Hunters Hill, Sydney, and is currently fourth year medical student at the University of New South Wales, currently undertaking a year of research looking at hepatitis C prevalence and treatment uptake amongst Aboriginal and non-Aboriginal people, specifically among intravenous drug use populations. He aspires to work as a general practitioner within community, however, is still very open to other specialties. Thank you all for joining us. I hope I did that justice. I know you guys have much more skills and qualifications than what we've written down, hence why we have you on the panel with us today. I just want to kind of open up just with asking you guys a couple of questions, if that's all right, and we'll just go from there. So I guess one of the big questions for me initially is, and I guess I might address this to Tom and Steve Stanton initially and then go to Steve Hobday, but how do you feel the current state of First Nations men's health and wellbeing is travelling at the moment? Do you want to go first, Tom?
Yeah, look, I think all of the areas around health for Aboriginal people and Aboriginal men, you know, as we know, pretty bad on all indicators. In fact, worst on all indicators. I think that the space around men, as I think Lomas was saying, as I was coming onto the teleconference, that it's often without involvement of people into the space. He also made the point around opportunities when opportunities arise. Just in terms of just general contact, I think is a great way of looking at things. Because we waste a lot of opportunities to really engage. In terms of the general space, well, I'll talk about mental health. Really, I think is probably the biggest area that I know of. That we, if you're looking really at the bad areas, we've got, high hospitalisation rates for mental health conditions. We have an extraordinary amount of people incarcerated, many of which don't get treatment, or when they do get treatment, it's actually in jail, as opposed to often in community services and when they're out of jail. The issues of suicide are well known. The areas for men, in particular, between the ages of 25 and 45 are extraordinarily high. We've got a very high youth suicide rate. We've got, very clearly on, as I was saying, on all indicators, men's health is really behind the 8 ball. I think the more remote that you get, I've seen a number of different pieces of work where men's health is really suffering in many ways. So I think we've got a fair distance to catch up. And I think we run the risk of being invisible, I guess, in the space. Yeah.
Thanks, Tom. Steve Stanton, do you want to add anything to that at all?
Yeah, look, I agree with everything that Tom said. I think one of the, surprising factors or facts at play is that, particularly for our mob, we have 35% of Aboriginal males are under 15. And, it's compared with the non-Aboriginal population of around 20%. So as the population is aging, for all other reasons, and we're dying far younger than non-Aboriginal people, but we have a very, very young population. And, whenever we look at men's health or male health, we seem to be looking at, and rightfully so, things like chronic heart disease, mental health or suicide being, the second largest contributor to morbidity in men generally, and, probably about the same for Aboriginal people. But I think looking at the demographic of 35% of males, Aboriginal males, are under 15 years old. And, Tom talks about engagement and the importance of engagement. How do we better engage with young males? I think is important, particularly regarding the health. So, I think we're looking at, when we think about men's health, we think about sort of anyone 18 and above. How do we continue that work, but how do we also engage with younger cohorts? And that whole very valid views on what good health and good well-being, particularly good mental health, looks like for them.
Thanks, Steve. And Steve Hobday, do you want to add anything to that as well?
Yeah, I think we're travelling quite well. There's been a lot of improvement in the last couple of years, but there's a few areas of we need to focus on a few areas that contribute to mortality and morbidity, such as tobacco smoking, substance use, and mental health particularly. There's a lot of suicide and self-inflicted injuries. There's a lot more among the Aboriginal population compared to non-Aboriginal population, and general injuries and experiences of violence quite high as well.
Yeah.
And 1/3 of Indigenous youth experience high levels of psychological stress compared to 1/8 of non-Indigenous youth. So it's quite a stark contrast there. But I definitely think we're heading in the right direction. We just need more engagement I think.
Great. Thanks, Steve.
Right.
Tom, with obviously some of those, well, not some of them, they're all really disheartening outcomes or measurements. Do you think some of our leadership has failed in the past, or is there something that's been lacking?
I think leadership do what leadership can do.
Yeah.
I don't know that it's necessarily a failure of leadership. I think it's, potentially a failure of systems and to enable leadership to occur.
Yeah.
I think there's been an enormous amount of effort placed into, from our parents, our grandparents, and many, many others that have really tried to push the agendas of Aboriginal and Torres Strait Islander people and Aboriginal and Torres Strait Islander men. And I think what we've had is resistance against that leadership. And that just plays out as it usually does when you've got, various systems that aren't wanting to play with you. It just pushes the issues back, and it continues to marginalise people from the table. It continues to marginalise people from the decision-making processes, and I think there's some potential changes that are happening. But what I'm encouraged about is that we've got so many people out there, and I think that was talked about just as I was coming out onto this video conference. And there are quite a number of people that are out there that are not just learning, cultural ways, but also the all ways of how do you actually manage into this space. And that's a real encouraging sign. We'd certainly need more, and we need to get to the areas of, at least population parity, because we're not there yet. I think medicine's about the only one that's got to the point where they've got 3%, I think, for about the last 8 years of Aboriginal people going into medicine. Now, it's a real, from my perspective, a real disgrace that none of the other professions have got anywhere near that. So, congratulations to medicine, but, they're a real shining light in regards to, shifting the game. Great.
Thanks, Tom. Steve, in regards to Tom's comment around it's a system issue, what do you feel we can be doing in order to navigate those systems, or actually to bring a more married interface between the systems and on the ground or grassroots work?
Yeah, it's a big question. If I had the answer, Stu, I think I don't think I'd be sitting here. I'd be working hard to implement it. But my personal view, and I guess based on my experience, is probably the answer I can give. As Tom suggested, I don't think leadership has been absent. Leadership has been very much present, particularly for Aboriginal men, and particularly in the mental health, social and emotional wellbeing space generally. And I've been in that space, started as a trainee in 2008 or 2009 as an Aboriginal trainee, and I've had some great leaders in the space. The ability to penetrate the system or disrupt the system that is a dominant system, an entrenched sort of system with our view, and allow Aboriginal Torres Strait Islander leadership to exist in that system or lead within that system, I think is where the blockages are. And the work that Tom's done over many years, the work that a lot of his colleagues have done over many years, we're starting to see that shift a little bit in the mental health, social, emotional wellbeing space. But I think, as I moved outside direct health services and back to where I sort of first begun, which was in the corporate world or the business world, I often challenge social and emotional wellbeing, health issues, whether it be men's health issues or general health issues, for the corporate world also to be having a look at it. Tom mentioned, the efforts by medicine at 3% of population parity. We're seeing, what is the role of the broader economy in creating good health as well, because most people are employed by some of the largest corporations in Australia. Yet we don't see any or many Aboriginal and Torres Strait Islander people leading these organisations, sitting on boards of these organisations who are quite influential in being able to advocate for policy change in the health space or the finance space or whatever it might be. So one of my, and being in the health system, and there's a lot of sort of advocates in that space, but one of my big shifts in the last 12 months has really been, how do we get more Aboriginal men and women into some influential roles in the corporate sector, who are building the medical centres where the Aboriginal services or Aboriginal doctors will work, that Aboriginal people will access, and to influence, the broader economics that can influence the health system. Because to be disruption is going to be a real key in this sort of very confusing world that we live in, where we're trying to get Aboriginal and Torres Strait Islander leadership to thrive. We've probably got to be more disruptive than we have been. I think we've got great leadership. Some of the stuff that Tom and his colleagues like Professor Helen Milroy, Pat Dudgeon, Tom Kalmer and alike are working on. And then you've got great practitioners at a practitioner level. But there's this big gap in between of where does the rubber hit the road. Good policy, good leadership on the ground. But for that to translate to the ground, there has to be this middle type, someone leading what is called intermediary sort of areas of service provision. Yeah. So I guess it's a bit of a skewed answer, but if I had the answer, that would be great. Stu, as I said, I probably wouldn't be sitting here. I'd be out there implementing it somewhere. But I think disruption is key, and we need to challenge the status quo. Yeah. Instead of being told, get back in your box, and Tom knows me well, knows that I'm not the type of person to be told to get back too easily. But I think it is about challenging that, but having the knowledge to challenge it as well. So really making sure that we do learn and understand and have that knowledge to be able to challenge the system, to create leadership.
I love that idea of disruption, and how do we do it? And hence why there's people on here speaking that are much smarter than me, and that are working in the space, because how do we do that? If we're talking about that intermediate area, how do we do it? Because I'm nor at the top nor on the ground working any longer. What are all of you, feel free to answer, is what do you think the first step towards that is?
If it was me, I think what we need is at least we need a huge investment into, and it's not just money, but it's an investment into the professions in which we require. And if we don't get to the areas that we need to, whether it's population parity or needs parity, if you're looking at needs, you're looking at 2 and 3 times what's required, as opposed to population parity. But I was involved with a psychology project some years ago, and the difficulty with that whole process was that in the work that they were doing, they interviewed people that were new starters to psychology, and they asked questions around, what do they need and that sort of stuff. And they said more information about Aboriginal people. They asked the same questions to early graduates of psychology, and what did they get? They get the same answer in terms of more information about Aboriginal people. Now that to me is just a flaw on both the education systems. If people are going into university, into a caring profession, and don't have the basics around dealing with Aboriginal people, there's a problem. But if they're going into a caring profession, then not getting the necessary skills to deal with, or at least the concepts to deal with Aboriginal people, then there's a massive problem, because they're not getting at the start. They're not getting. There's two systems here that have failed
Yeah.
dramatically, and I
Yeah.
think I mean that's just one example of things. So if we don't have people on the ground, as Steve was saying, as well as leadership, as well as people that are coming through, as well as these 35% of kids under 15 getting a good education and can actually see themselves in the education system,
Huge point.
rather than being invisible in the system,
Mm.
whether that's in psychology or whether that's in the school system. I think it's a real concern.
Yeah, I hear you 100%. It's a fundamental issue that starts right back in early childhood education all the way through to higher education. The fact that, as you said, you've got care professions doing maybe one course in a university degree, that focuses a little bit on political history is not giving anyone the skill set in order to deal with First Nation health issues at all. Steve, you're in the system at the moment at university, and sorry guys,
Yes.
I will go back to the questions that I did send you originally, so I apologise for that deviation. I just wanted to explore that a bit more. But how have you found affirmation, or as Tom says, seeing yourself in the learning? How do you see Aboriginal stats represented in your education, and how do you see yourself in there?
I'm not too sure about the stats about Aboriginal people in education, but as far as seeing myself, you feel a bit disconnected from the system at times, especially when So at university we have a Centre for Indigenous students. And at times you can feel a bit disjointed from that because, sometimes there's a bit of politics or, you don't get along with everyone. So I feel like it's hard for you to sort of, have a sense of community at times. But I'm lucky that I'm at this university because there is a lot of students that are in a similar situation as me. And we come together and study and pass our exams, and we're working towards the end goal of becoming a doctor, to then work in community. But going back to what Steve Stanton was saying before, about we need more Indigenous people on boards. I actually read a paper and it said that over 70% of organisations that focus on Indigenous primary healthcare services, about 50% of board members were Indigenous. So I think this is the right step forward. And 41% of health staff employed in Indigenous primary healthcare organisations were Indigenous. So yeah, we're moving in the right direction, and there's definitely room for improvement, especially towards the treatment of Aboriginal people at these services. As a stat said, 20% of Indigenous Australians reported being unfairly treated by healthcare staff. I'm not exactly sure why this was the case, but I'm sure it's a problem with cultural sensitivity and respect.
Perfect. I've just got a question that's come in from Jeremy. I'm not sure which Steve it's directed at, but it says, Steve, has Nuragili changed with the pastoral support since the old days? It's great to see you succeeding. Do you feel supported through Nuragili?
In the last 2 or 3 years, not particularly.
Yep.
So they dismantled the whole thing basically. They had some staff leave, and new staff come in, but it was never the same type of community feel that I experienced in my first year. But there is a lot of academic support. They've got a tutoring system where you can get up to 4 hours of one-on-one support from a student, from an older student that studied medicine. That's been a lifesaver in the last couple of years. But yeah, the sense of community just isn't there. I'm glad that I'm living in college and I have a lot of Indigenous peers that I can that I can talk to for support.
Great. And look, the questions that I'd sent you earlier was one was to you, Tom, is what leadership is needed to develop better social and emotional well-being for First Nation males. But I don't think that's the question it asks at all. It's actually what systems do we need? What processes do we need to embed in order to start getting better outcomes?
Well, I think we just need to be at the table, and I don't think we are all the time. The context around Aboriginal medical services, which is the most comprehensive system that exists out there in regards to providing services to Aboriginal and Torres Strait Islander people, is often left off the table. It's not the first at the table. It's always, often led by others, as opposed to led by Aboriginal people, whether it's Aboriginal men or women or young people, whatever the demographic might be. It needs, there's a principle there. And the other thing that sort of really irks me a lot is that, and I'm sure many of the others that are on the line, is, you're often invited as the last person at the table, rather than, a set of ideas that are coming up, whether it's jointly or whether it's led by Aboriginal people, which is the preferred model. Coming in last on the discussion becomes a real dilemma. And then you're only meeting someone else's agenda or trying to shift what has already been decided. So what I would like to see, I guess, and there's certainly some work around the Coalition of Peaks, where there's an arrangement of exactly setting the agenda rather than just responding to an agenda that's already set. So,
yeah. I think your words are so wise there. Being the last at the table just means you're fighting uphill straight away because decisions have already been made. But also, I guess again that disruption is how do you get people to listen to that? When we're living in a time where previously up until now we didn't even have an Aboriginal Minister for Aboriginal Affairs and those types of things. Obviously you're pushing on that. What are some of the things you're doing to push back to ensure that those voices are being heard and that you're not the last person at the table?
Well, one of the things that we have done, and in particular with the Wiradjuri Proud Spirit organisation, we've been going 3 months now. It's not a 3-month process. It's been sort of a good 10 years of working around trying to manoeuvre into a space where, for the first time, we've now got a leadership group around the mental health space that is actually funded by government, and the essential roles for that, and the Wiradjuri Proud Spirit Australia is based on the declaration that was launched in 2015. Now, the declaration talks about the best of both worlds, and has 5 main principles around it. But it's about ensuring that there's an equitable arrangement in regards to good care for Aboriginal and Torres Strait Islander people. And the interesting thing about this whole process is that the declaration is now listed into the 5th National Mental Health and Suicide Prevention Plan. Aboriginal and Torres Strait Islander people are listed in that plan as a priority. Now, it's taken 5 plans to get to the point where we've got Aboriginal and Torres Strait Islander people as a priority. And this is the first time. The 2.5 years into this plan already. So I've only got 2.5 to go. But the other part to this is that there's also So the role of Wiradjuri Proud Spirit Australia is to implement the declaration. The other part to Wiradjuri is to implement someone mentioned the social emotional wellbeing framework earlier as well, and there's that piece of work that needs to be done, both of which are listed in the 5th plan. So by default, the governments have already agreed to that because it's a COAG document, the 5th plan. The other little piece of work that we're involved in is there was a suicide prevention strategy back in 2013. Didn't get a lot of attention at the time, but we've got the brief to take that forward in terms of the renewing that policy or that strategy. So what we're trying to do is to load up the mental health space, load up the social emotional wellbeing space, and also load up the suicide prevention space with an organisation that has got a collective group of, we've got the National Aboriginal Leadership Group, we've got the Indigenous Doctors Association, we've got the Indigenous Psychologists Association, we've got Indigenous Allied Health Australia, the Centre for Best Practice for Suicide Prevention, and the National Critical Response Group. So it's a fairly powerful sort of little group in terms of the membership on the board. So I guess what we're trying to do is say, look, we're here, we're happy to work with anyone that wants to work with us, but we're also there to lead some of that directional stuff to assist many communities across the country in regards to what might happen for them.
Yeah, great. Which is lots is being done essentially in a small answer. I've had a couple of questions come in as well, if you don't mind me just posing them to you guys. One was from Phil Pallas, and he's asked, what role do you think the Uluru Statement from the Heart plays into these groups and into the space?
Central to it.
Yeah.
I think, you know, that was one of the most powerful pieces of work that I've seen, and a long process. And sometimes these things are a long process to get them right. We haven't had the attention that's needed in regards to it from, you know, anyone that, you know, but it's generated a whole lot of other people that we didn't expect to join in on that people's document, which it is. It's essentially a document to Australia. And regardless of politicians, regardless of you know, how that might happen, it's saying that the people will take this forward. And I think that's a great thing.
Yeah, fantastic. And John Habnan, who's from Nacho, has asked, can one of the speakers comment on the structural social determinants of health and the social determinants of health? Sorry. Yeah. Does that make sense? Someone comment on the structural social determinants of health.
Anyone?
Just confirming structural, meaning, you know, the different levels of social determinants of health. Is it a general comment, or I'm reading the question as well, Stu?
Yeah.
Does John want to? Is John? Have you got a mic? Did you want to
clarify a bit?
You there, John? You're back on mute.
He might type away and clarify a bit more. The other question, sorry?
No, it's fine, Stu. Keep going, mate.
Keep going. What part of this change can only Aboriginal men be involved in? And what is the role for non-Aboriginal men?
My view on it is what part of this change can only Aboriginal men. I don't think we should be putting limitations on, you know, ourselves as Aboriginal men. and where we should be involved and where we shouldn't be. I think the more Aboriginal men we have across a range of different leadership or the leadership ecosystem, the better. And we've got, an emerging group of males that we're going to see more Aboriginal men in the next 10 or 15 years, in their mid-20s, the 30s, and into their early 40s, where they're going to be of working age, where they're going to be, our population is really going to be men between 25 and 40, where we can stand up and have some influence and talk, we talk about disruption. And I don't think there needs to be a role just for non-Aboriginal men either. I think as Aboriginal men, we do have an inherent responsibility to our community and our families, and as well do non-Aboriginal men. But we've got to say that Aboriginal men's leadership, over the last 200 years has been suffocated by historical context of past policies, right through to systemic racism and systems that still don't allow Aboriginal men to lead with their level of responsibility, and which I'm sure you're an Aboriginal man, you've been involved in any system, you may have witnessed that firsthand. I certainly have, as where you are called to the table last, or your view is a little bit lighter than someone else's view because it doesn't fit within that system. So I don't think we need to be able to discriminate leadership against whether you're Aboriginal or not. I think the more Aboriginal leaders, particularly Aboriginal men that want to step into the space, particularly collectively, is going to be important, the better. I don't think there's a role one or the other. I think as Aboriginal men, though, we need to understand what our role and responsibilities are, and how do we best execute our responsibilities. And, I would definitely say for myself, and just reflecting back on my leadership journey, I was in a relatively young executive, sitting in a room with 45 to 65-year-old white males. And I was a 26-year-old Aboriginal man sitting in there. And most of the boardrooms or executive rooms I've sat in consist of non-Aboriginal people and mostly non-Aboriginal male. Now, it's not saying that they're not productive spaces, but at times you do feel quite isolated culturally. You feel like sometimes your opinions, and it takes a lot of confidence and to speak up, and a lot of resilience. So I think as Aboriginal men, our role in developing leadership in this space is to support that, younger men that are emerging, and build that resilience and build that confidence, not in a disruptive, a bad disruptive way, in a good disruptive way. That we actually need voice and leadership, and not just be satisfied with being asked to the table, but pulling people together and, driving the agenda, and being productive. And Tom will tell you this is, I think there's been some great leadership, as I mentioned, probably 15 minutes ago. There's been some great leadership in the space of mental health, suicide prevention, social and emotional wellbeing by Aboriginal leaders. But I think it's going to take more than that. I think it's going to take more than good policy. I think it's going to take more than good frameworks. It's going to be about how do we do things differently, because disruption is challenging the status quo. It's about looking at how we do things differently and being uncomfortable about that. I'm not comfortable with, the fifth National Mental Health Plan 2.5 years in and hasn't been, great significant shift. Yeah. I'm more comfortable in collectively, how do we put our minds together to come up with something innovative, and be disruptive. And I really think that's what it's going to take to really start developing and getting outcomes. I just, last 10, 12 years, I've seen so many policies that just sit in top drawers, and hopefully Wiradjuri with its mandate can actually now light the fire under some of that. Tom's got a big job.
100%. And I think you made a really pertinent point, Steve, as to how do we bring some of those younger men along as well. You've often mentored me, and I've probably done your head in lots of different times, but you've also, still, but you find that patience with me, and we have these conversations, and they help me to grow. But it's always been done, majority of times, in a way that has helped me grow rather than stunted my growth. And I've always valued that. And I've also seen the opposite in the space, though, where some of the younger men trying to move into a space are often not nurtured and not valued. And so how do we wrestle with some of that as well, which to me isn't a cultural framework. It's more of a Western framework to keep our youth down, rather than a cultural framework is about making space whilst mentoring, not giving the floor, but also mentoring.
Just ducking back to that question around
Yeah.
social determinants and that type of thing, I guess there's probably a few things. It is about, and you'll see the chat room comment in regards to social status. The more improved social status you are, the healthier you'll be, and that's true. But I guess, how do we shift and change some of those big system sort of areas? And when you've got everything that we do that's positive always comes back with a negative. For example, and I don't want to get into it too much, but the Black Lives Matter, the protests and that type of thing, people are going out because they're actually caring about their communities and the death and the different things and the systematic racism and the likes. People see that as being absolutely central and crucial to the continuation of Aboriginal people and so forth. Yet the only thing that was, really sort of reported on and got all the airwaves was we're out there doing this during COVID. And that then becomes the negative on top of us and that type of thing. So it becomes this power of what have you got to say, but when can you say it, and then what do you do about it when it gets portrayed back as a negative. And that's what happens all the time. Same as, when the Uluru Statement was thrown into the mix, the first response was a third chamber of government. It was never a third chamber of government, So, there's this constant cycle of opposition that gets thrown back that always overpowers the Aboriginal people trying to push through on some of these really, really critical issues. And I think that's true for social determinants and the like. So I think we've got a continual battle on our hands in regards to getting enough people walking with us on these issues to actually get it through and get it over the line. At some point in time, you'd hope that might be the case. But the other thing I might just sort of quickly link that to is, and this is ducking back to what Lomas was saying, the issues that sort of have presented themselves out of COVID are absolutely stark in regards to the impact on the potential growing of leadership. Because what's happened is that particularly in rural and remote communities, there was an exit of all fly-in, fly-outs. They all flew out. And, there was all sorts of reasons for that. There was biosecurity legislation that was enacted that was closed communities and all those sorts of things. But what it left communities with was their own devices to deal with things. So they didn't have access to, good mental health supports and that type of thing, because they were all the ones that flew out. So what we need in regards to that is better place-based opportunities for people to have skills within communities, so that when the next COVID or disaster or whatever it might be takes place, there's communities that can deal with things. We've got, and the example I'll use is, people wanting to leave, elders wanting to leave communities. The reason people wanted to leave communities were people were scared. People were fearful of staying in communities, felt that they'd be better and safer in a big city. And what's been absolutely demonstrated and shown by Aboriginal communities is that it's actually, has been a fantastic effort from all of the key Aboriginal organisations to protect communities and so forth. But the other thing I'd say with that is that in terms of building our leadership into the future, what it's also identified is that all of the universities that exist across the country had to reshape and rechange their models of education and learning delivery. So if we're going to support place-based learning in communities, then they've already demonstrated that they can do it by changing their delivery models. They've resisted that for years and years. And now they've done it, we should be holding them to task so that we can actually do the training of people within the communities in which they live so that they don't have to move.
I don't think there's ever been a truer statement, which is great. Steve, Hobday, I know we've kind of left you over there, brother. So I want to pull you back in by also asking, you're potentially our future. What do you think some of our future leaders, after hearing what our leaders are saying, where do you think the future is?
I think the future is in educating more Indigenous people and keeping them engaged throughout the education process. You'll find that a lot of people come to university, or they come to university and they study a degree, and they have all these aspirations, but they get lost along the process. That's because they don't have mentors, and they're so far, they're disconnected from their community and culture. So we really need to focus on doing that. And there's been limited times where people have come to university or college and said, hey, let's go out and go bush for the weekend. Or, hey, let's all meet up at the local community centre and have a yarn. So that's just a big issue that we're facing at the moment. It's just a lot of disengagement. And even Indigenous kids finishing year 12. In 2016, only 65 of Indigenous kids finished. There's a lot of room for improvement there. And that could be due to the same things, just a lack of engagement and mentors and whatnot.
Which I think you've got a couple of really good points there. One is around keeping people engaged, but also mentoring needs to be put on the agenda, but also cultural influence and how to keep people engaged in culture and identity.
Yeah, and I think a lot of people just lose track of what they're doing the degree for. We really need to teach these young people to not just do a degree just to have the degree, but really find that purpose. Have that end goal. Because that's what we all strive for, is just to have a sense of belonging and meaning in our lives.
Great.
That's how we can all stay motivated.
Thanks, Steve. Last comments. We have 10 minutes left. We've got a comment down here. It says Lomas needs to take his camping on country program into university. It's easy. It's as easy to get lost in the uni system as it is in a remote community. I completely concur. And for me, look, a huge process for my upbringing has always been around cultural identity, and I've had so much luck with that. I guess I might direct a bit of a quick question to Steve Stanton around the influence of cultural knowledge and what it plays in your role in executive positions, but also in all aspects of your professional life.
Yeah, look, I think identity and, what you're connected to, whether it be country, family, your story, is probably the biggest anchor that we all have in our life. And, if we have strong connection to our knowledge, to our storylines, to our country, to our family, you can lead well. So I think, for me and personally, having having that as kind of the centerpiece that's anchored me, and I've been able to survive the challenges that's I've faced in my professional leadership career, and as an Aboriginal man walking into health services, starting off as a trainee and moving through to different executive roles in housing or health or business. You're always challenged because as an Aboriginal man, often the decisions you need to make or you have to make are often in conflict with, or potentially in conflict with your values, your cultural values, or your responsibility to community. As a leader, sometimes that can be really challenging. And this is when I talk about resilience and perseverance and being, being strong and staying connected. So if you have that good anchorage to knowledge, to your storyline, to your culture, to your community, to your family, and as an Aboriginal man, to your responsibility, often in those challenging times in leadership, you won't waver. You'll be persistent. You'll be resilient, because that's what it comes back to, is what you know is what you know. And those values will stand strong, and those values will push through any adverse disruption that's thrown in your face. And I think any Aboriginal man who has been in any workplace can identify with that, or any Aboriginal person that's been in a workplace could identify that. But it's continually building that my cultural knowledge, my connection to country and family is my priority. Because I know if that's strong, then the work that I'll do day to day, including spending time with youth stew, which takes a lot of my energy, that will thrive, and I'll be able to be a more resilient, persistent person, but maintaining the values to why I do that is important. And if something doesn't align with my values, I won't do it. It's that simple. Or I'll ask not to do it. And there's been times where I've put in situations in the corporate world where it's multi-million-dollar investments, in talking about social determinants of health in housing, where I advocate for mixed tenures. I'm saying, part of $1 billion housing development, I want to see 20% afforded to social housing and Aboriginal housing. Why should we be setting up these estates? And saying that in a room full of middle-aged white men who are very wealthy can be disruptive. And if your values, if you don't stick to your values and your beliefs and there to support community, you won't see those things come to fruition. So that's what I mean about challenging the status quo. But without knowledge, without understanding, without that connection, it's hard to be resilient. So we've got to equally spend as much time on all of those things as we do in our day job. So you spend 8 hours or 9 hours a day at work, equally spend that amount of time connecting with your family, connecting with your country, and reflecting on your own values.
I think one of the other things, Steve, is around decision making and having you've sort of touched on it. How do you ensure that your values and your identity and so forth are part of your decision making? And we are all in meetings at different points in time, whatever meetings that we're attached to. And sometimes we need to make decisions that are there and then. There's no ways of moving around that. They won't sort of enable the processes around, let's go and consult with communities and this and that and the other. There needs to be a decision made. So you have to actually lock in your own values into your decision-making processes and that type of thing. And, the types of things that I sort of try and think about when I'm sort of in that uncomfortable position, which it is for all of us, is to say, well, if I had to defend that to my aunties or my mother or my different people, could I do that comfortably? If I can't, then it's a wrong decision. Then I'll have to do something, make it a decision different to that. But if I am comfortable in defending that decision to my mother's not alive, so I'd still have to defend it because it's about me and it's about her and it's about all of us in that context. And if I can't defend that decision, then it's a wrong decision. So that's how I sort of try and sort of line up some of the things that, in our daily life, our work life, in terms of trying to merge that together, if that makes sense.
100%. And thank you both for your comments there. I've seen that Glenn has come on. Glenn is the CEO of the AMHF, and he rarely sticks his head out unless he wants to say something. So, because he's normally running behind the scenes in the background. Not in a bad way, Glenn. Is there something you want to say, or are you happy for me to continue?
No, you continue. I just wanted to be here when you closed. I've been listening all the way through. It's been a great conversation.
I feel really privileged to be able to have been part of the conversation, because I know, Steve, you're so flat out with your uni work, and Tom and Steve, you guys are extremely flat out, and it's definitely been a great deal of learning for me. And I hope it's been for everyone else. If not, I'm taking a lot away from it. But is there anything final that you three gentlemen would love to kind of leave people with as we close the session out? Steve Hobday, do you want to go first?
Oh, I don't have anything in particular to discuss. Just going back to identity, I guess, in connection to country. There's still a lot of kids that are being removed from families. I saw a stat in a study. It said that in 2014, 2015, 7% of Indigenous people aged between 15 and 24 had been removed from their natural families. So yeah, it is a problem that continues, despite all these policy changes in government to supposedly prevent children being removed. But it said that 83% of these kids were able to connect back with their families without the need of services. And among these kids, 49% that were removed from their natural families experienced high levels of psychological distress. So that was interesting.
Thanks, brother. I appreciate it.
That's okay.
Interesting to maybe hear some of the stories of the people that are reconnecting with their families, and to hear some of the hardships and traumas they've been through, because I think in their narrative we may find some other answers to moving forward as well. So thanks for sharing with us, Steve.
That's okay.
I think if I had last passing comment, I'd sort of talk about cultural education and education more broadly. If we're seriously looking at leadership, that's the potential two areas in which we need to sort of look at leadership. Just in regards to education at universities and so forth, it gives people opportunities that potentially didn't exist before. And one of those opportunities, and the easiest way I'd like to explain it, is at the start of university, you're eating chips and gravy. And at the end of the university, you might eat a steak from time to time because you're actually getting more money. So I guess there's a number of different ways of sort of looking at the same sort of thing. But if you can eat better, you can then do better. If we're growing healthier kids, we can do better. If we're getting healthier kids into university, that's fantastic. And if we're not eating chips all of our lives, well, that's even better.
Thanks, Tom. I think you're so right. There's a wonderful analogy, because education is food, isn't it? And if you can follow it, digest it, and help it to become a better part of you and your family, the outcomes definitely are much better than the heart disease you get from eating chips and gravy your whole life. Thanks. That was great. And Steve?
Hey, look, I don't have a handful of metaphors like Tom did, but and every time I've been to lunch or dinner with Tom, he's had a big plate of chips as well. So don't let him fool you too much. Look, I think for me, just focusing on the notion of leadership, the last 12 months I've travelled to 3 or 4 different countries with some of the top universities, Stanford, UCLA, Oxford, etc. And the notion always comes up around leadership as authenticity. And whether you're leading in the mental health space, in the corporate world, in a fish and chip shop for Tom, being an authentic leader is always voted, number one. And if to be authentic, you must understand where you come from before you can really understand where you want to go. So, be authentic, continually to reflect on your own leadership style and others around you. And there's a saying is, reflect inside, outside, and over time. And don't be scared to challenge that status quo. And I think, and grab on to young Aboriginal men and Torres Strait Islander men where we can to support, and whether that's personally or whether that's in the workplace, to grow leadership, because in 10, 20 years time, we're really going to need it. Probably more so than we are now.
Yeah. Well,
just adding on to what, adding on to what Steve Stanton was saying, it's important to be, authentic, and show younger people the way, but it's just as important to be consistent. You see a lot of these sports stars, they're leaders on the front page of the newspaper, but then at other times they're involved in drugs and alcohol, and it just destroys everything that they've created, and they lose respect from a lot of people, and kids think it's okay to behave like that as well. So just for ourselves, I think it's important to be consistent, continually work on ourselves and lead the way.
Yeah, great words, Steve. And if we stick around authenticity and also sincerity, I want to sincerely thank you all for sitting on the panel. I've learned so much, and honestly, it's been a really great honour. Steve, unfortunately for you, I'm going to continue to drive you nuts, but I really honestly thank you a lot for helping me get in contact with Tom. And Tom, thank you so much for genuinely giving your time to assist us today. And Steve, good luck with the rest of your degree, mate. I have no doubt you have a huge career ahead of you. So thank you all so very much.
Great. Thanks, Stu. And thanks, everyone.
Thank you all.
Thanks, Stu.
Okay. Thank you very much.
Well done.
I think that's it. That's the end of our sessions today.